Respiratory diseases come about as a result of interactions between infections, climate, and infection pressure. All three factors should be considered during the prevention and treatment of respiratory diseases in pigs. Dr. Philip Veit founded and leads the private laboratory Dial Lab, a diagnostic laboratory for animal samples based in Belgium. He studied veterinary sciences at Ghent University, graduating in 1989, having won 2 awards for his thesis. Since then, Dr. Veit has worked in various veterinary roles, became a diplomate of the European College of Porcine Health Management in 2006, and completing a PhD which focused on the examination and storage of liquid porcine semen in 2007. During this focus video, Dr. Veit talks about some common viral and bacterial infections and how they are diagnosed.
Hello, I'm Philip Veit. Today we will talk about diagnosis of respiratory infections in pigs. When we talk about respiratory disease in pigs, we actually mean an interaction between infections, viruses, bacteria, parasites, which we will discuss later. Secondly, the climate, things like ventilation, air currents, gases. And thirdly, infection pressure, things like stocking density, mixing of piglets, the use of all in all out, and of course, very important, the antibodies, the vaccination status of the animals. All this together we call the respiratory disease complex. So when we look about viral infections, the first virus we see is PRRS. PRRS is a virus which is very widespread. You have 2 large types, the North American type and the European type. And within both types you have several variants, and all those variants make it very difficult to have an optimal immunity against the virus. The virus comes in by inhalation. The first thing it goes to is the blood, and from the blood it spreads, for instance, to the lungs, where we have damage in the lungs, making a pneumonia, which is then very susceptible to secondary infections. The virus can also go in the genital tract, where you can have embryonal or fetal death. Very important with PRRS is that animals can be carrier after infection, carrier for several months, for instance within the lungs. How do we diagnose PRRS? Well, we can first of all look at the reaction of the animals. We can measure antibodies within the serum, or we can also look at the virus, better to the viral genome within, for instance, lungs, TBS samples, also in fetuses. But watch out, when you do the interpretation of the result, think there can be carriers also. Second, in the viral infections, we have influenza. It's also very prevalent. There are several influenza viruses in pigs which are circulating. The classical types H1N1, H1N2, H3N2, and then the pandemic types. Influenza virus gives lesions within the alveoli, so you get a pneumonia with fever and respiratory signs. Diagnosis is a bit similar to PRRS. We can detect antibodies to the different types of influenza, and we can look for the genome and type what we find to have an optimal idea what we should vaccinate. Because it's very important that we have animals protected by antibodies. Maternal antibodies, by the way, are staying until 10 to 14 weeks. In this slide, I will show a lung from viral infection. You can see the lung is swollen. You see the mixing of dark and pale areas, which is normal, and inflamed tissue. That's typical for a viral infection. Another viral infection we encounter in pigs is PCV2. It can also give a pneumonia. Also, this virus is very widespread. You have different genetic types, but the virus infects lymphocytes that are those white blood cells which are important in immunity. So whenever those cells are destroyed, you get impaired resistance, so wasting of the animal. You can also have a respiratory disease, really pneumonia. And on the other hand, When the pregnant uterus is infected, you can have embryonal or fetal death. Diagnosis in this case can be done by serology. We can look for antibodies, but we can also look for the virus. And important in this virus is that we look how many viruses there is, because it's a virus which is very frequently present, but if there are lots of them, we know that it can be linked to problems and symptoms. Other viruses important in respiratory diseases are coronavirus, respiratory coronavirus, inclusion body rhinitis. Luckily, they aren't very prevalent, but they can be a trigger in the PRDC complex, the respiratory disease complex. So after the viruses, we come to the bacterial infections of the lungs. And here we have two bacteria which are very important in the respiratory disease in pigs. First of all, we look at Actinobacillus pleuropneumoniae. This bacteria produces toxins, and those toxins destroy the alveoli and the blood vessels within the lungs. So you have a hemorrhagic pneumonia with acute death, blood from the nose, and symptoms like that. When animals survive this stage, they go to a more chronic stage with abscedations within the lungs and adhesions between the pleura and the ribs. Very important in Actinobacillus pleuropneumoniae are carrier animals. They bring the disease in, mostly, and spread it to other animals. To give you an idea on the lesions, I've put 3 photos in this here. On the first one, which is at the right bottom, you can see an acute APP lesion with hemorrhagic pneumonia. Afterwards, the lesions are confined by the immune system, as you can see in the upper photo. And finally, it becomes like an abscedation within the lung, and the lung is adhered to the ribs by a pleural adhesion. So the second bacteria, which is very important in respiratory disease in pigs, is Mycoplasma hypopneumoniae. This bacteria impairs the ciliary movement. Within the respiratory tract, the cells have cilia, which are important for eliminating dust and mucus from the airway system. This bacteria, Mycoplasma, destroys the cilia, which makes an accumulation of mucus within the bronchi. When there is a lot of mucus in the bronchi, there is not enough transport of oxygen to the blood. Second disadvantage is that there is an environment for secondary infections by other bacteria in the lungs. So you get severe pneumonias next to the loss of oxygen. Very important in Mycoplasma hypopneumoniae are the carrier animals. Animals can be carriers for several months, especially young animals, spread the disease, for instance, to their piglets. It's also an airborne pathogen, of course. How do we diagnose Mycoplasma hypopneumoniae infection? Well, we can, of course, look by PCR to detect the viral genome, the bacterial genome, but we can also look at the lesions itself on histological sections. And as you can see in the slide, you see a lot of inflammatory cells around the bronchi, constricting the bronchi so that there is not enough transport of oxygen from the air to the blood. Serology is also possible to detect the moment of infection. And monitoring at slaughter is another option to have an idea if the measures you take on the farm are sufficient or if there have to be additional measures. Next to those bacteria, which have an influence on the lung itself, we have to look also at bacteria which have an influence on the nose. Rhinitis, there are 2 causes of rhinitis in pigs. You have the atrophic rhinitis, which is produced by toxins from Pasteurella miltocida, and these toxins destroy the bone structure within the nose. So if there is no bone structure, all kinds of bacteria can get in and you have secondary infections. On the other hand, you have all kinds of bacteria, Streptococci, Pasteurella, for instance, which produce a purulent rhinitis. It's like whenever the air passes through the pus or the mucus, you will have bacteria within the lungs. So whenever there are lesions in the lungs from, for instance, viruses, you have secondary infections. So next to the virus and the bacteria, we can also look at some parasites which are important for respiratory lesions. We have a specific parasite in swine, which is living within the lungs. It's a lungworm, Metastrongylus, but it's very seldom in normal modern husbandry. The most important lung lesions from parasites in pigs are from Ascaris larvae. Larvae from this parasite, they penetrate the liver and afterwards they go to the lungs in a cycle to become adults. They are very important as a primary mechanical induction of lung lesions. So hygiene and deworming strategy are of course very important. To give you an idea, you can see here the lesions of Ascaris larvae. And you can see on the liver the pale spots, which are lesions from migrating in the liver. And in the lungs you can see that there are several bleedings and very focal pneumonia lesions within the lung at different points. So these lesions are quite typical for Ascaris. So very important when we look at respiratory disease in pigs, don't just look at the viruses, the bacteria and the parasites. Also look at the environment, climate and those things, and think about things like stocking density and immunity. Thank you for your attention.